All right, good afternoon, everybody. Here for our afternoon briefing. I've got Josh here and two special guests I get a chance to introduce to you in a minute. I'm really proud of that. But first, let me give you the daily summary. It is, I think, good news, given where we thought we should be on the day before May 20th, which is our Phase 1 reopening day. Positive cases as a percentage of tests performed is less than 5%. That's that's the lowest we've seen, I think, in a couple of months. And also, it's very good news. You see the number of tests performed is 7,800. So we've gone through that 42,000 number we were counting on. Now north of 50,000 is based upon these metrics. Number hospitalized continues to go down slowly, but fortunately, the number of fatalities. So these are trend lines that I think give us some confidence that what we're trying to do tomorrow with our slow and methodical reopening, the timing is right, and we've hit the key metrics that we thought we would. I just want you to know that we have a lot of expertise inside of this building. I think you know from the reopening advisory board, we have amazing expertise around the state. We got folks from the scientific community, we got from the folks from the business community. They'll be giving their report tomorrow. But we've also had a couple of advisors who have informally helped us along the way, who bring an awful lot of breadth of perspective to what we're trying to do. And they are, Dr. Scott Gottlieb and Zeke Emanuel. Scott's going to say a few things first. I always like to boast about people's Connecticut roots. Scott is Wesleyan guy, Pfizer board. And to me, I got him because he's a dad in Westport. And I think I gave him a call probably, Scott, on the day that we announced that schools had to close down, and he started paying extra special attention to what was going on in his home state. He's here with his wife, Allison. Allison and he help lead Homes with Hope, an amazing organization that provides shelter and support for people in need. We have a lot of people in need right now. And I particularly enjoyed talking to Scott, not just about where we are here in Connecticut, what we see around the country, but he also is thinking about this summer and this fall and what we can learn from a guy who was, as you know, commissioner of the FDA under President Trump, an incredibly thoughtful and innovative commissioner. With that, let me introduce to you Scott Gottlieb.
Well, thank you for that, Governor. It's a real honor to be here today with everyone. I have a lot of ties to the state. As you mentioned, I went to college here at Wesleyan University in Middletown, Connecticut, practiced medicine for years at Stanford Hospital, now reside in Westport, Connecticut. And so I have deep ties to the state. And I want to thank you and your team for what you've done to get us through a very difficult moment in this state. We were hit very hard here in Connecticut, being in the tri-state area. And I think that this state has made it through some very difficult days under your leadership. We've been able to dramatically scale testing in the state. We supported the healthcare system. We were able to backstop doctors and make sure the healthcare system didn't get overwhelmed. And we're seeing transmission come down quite dramatically. And I think we're at a point in this state, as you rightly note, that we can start to contemplate a thoughtful staged reopening of economic activity, having been successful at flattening the curve and making sure that the healthcare system didn't get overwhelmed and preserving life in the state. And now we're at that moment to try to start to restart activity in a thoughtful way. I would just start off by noting that, I think we in this state had a very thoughtful approach in terms of what we did do when it came to population-based mitigation. And there were certain activities that continued in this state. I think it was very thoughtful and prudent, the approach that the state took in terms of allowing certain activities that were low risk, things done outside, for example, to continue during the mitigation phase. Going forward, I just want to touch on 2 points briefly, some principles for what I think should guide us, and I know this is guiding you and your team, and in what we can, look towards as we head into the summer and the fall. It's going to be very important to lean on the case-based interventions as we go away from population-based mitigation, basically trying to suppress the infection by implementing measures on an entire population, which is what we were doing now. Now trying to target the virus itself and trying to support people who are infected, get them identified, get them tested. And we're going to be dramatically scaling testing resources in this state and try to track down people who may have been in contact with them and offer them testing. and offer them interventions to try to enable them to self-isolate and make sure that that's non-punitive, that people are encouraged to get tested and self-identify with the virus, and that being diagnosed with COVID doesn't become a punitive thing. We want to encourage testing in the community and get it out into the community. And particularly, as you're doing, focus the testing on at-risk populations and at-risk sites. Not everyone is at equal risk of COVID, and we've seen some jobs and we've seen some communities hit especially hard by this virus. And that's not unlike any infectious disease where we see a disproportionate impact of infectious disease on certain communities and people who work in certain jobs. And this disease has been no different. And I think, to your credit and to the state's credit, you're thinking very, very heavily on focusing testing, both symptomatic and asymptomatic testing, on communities that have been hard hit and are more vulnerable to the virus. And the other thing I would do, and you and I talked about this, I'll just put in a plug for getting vaccinated for the flu going into this season, going into the fall. I think it's going to be very important to get flu vaccination rates up. And anything businesses and community leaders can do to try to move towards more universal vaccination for flu is going to be exceedingly important. First of all, it's going to improve our syndromic surveillance. It's going to improve our ability to detect COVID if we can reduce the incidence of flu. Second, it's going to reduce the burden on our healthcare system going into the fall. And, people who got co-infected with COVID and flu, and there were quite a few in the beginning, especially when we looked at the data coming out of Asia where flu was still epidemic at the time that COVID was circulating, had bad outcomes. And so we want to make sure that we can protect people at least from flu, even if we're not in a position to fully protect them going into the fall yet, with technology from COVID. And so what should we look towards? Well, as we reopen, we know there's going to be an uptick in cases. We expected that. We're going to see more hospitalizations. We're going to see cases grow. And that's why it's important to have a staged reopening, as this state is doing, and look at the data and lean heavily on those case-based interventions to try to reduce the number of cases that we see increase as a result of our increased social interactions. It's very important that as individuals, we continue to practice all those measures that we know reduce spread, wearing of masks in public where we can, good hygiene, remembering to socially distance where we can. Those kinds of individual practices done on a large scale have a dramatic impact on an epidemic spread. And so we should all continue to be prudent even as we reopen activity. Things done outdoors are generally less likely to transmit the infection than things done indoors. So we should look to move things outdoors where we can. And the state's thinking thoughtfully about that, about restaurants and other venues that we can move outside where there's a lower risk of transmission outdoors versus indoors. And my hope is that as we move into the summer, there will be a seasonal effect here. I think there is a seasonal effect here. We don't know how profound it's going to be, but respiratory illnesses and coronaviruses generally don't propagate as efficiently in the summer. Now, since we have no really cross immunity to this virus, it's very novel. We're still going to be susceptible to it in the summer, whereas normally we wouldn't be susceptible to a coronavirus in the summertime. But we should see the summer have some impact on viral transmission. And so hopefully as we reopen and we increase risk, the benefits of this seasonality of this virus will help offset some of that risk, and maybe a lot of it. And we'll be able to have hopefully a quiescent July and August and get back to more of our normal activities. And I'll just close by saying, if that optimistic case comes true, and I hope it does, I hope we reopen with success. I think we will. And I hope that July and August we can take a little bit of a breather and get back to more of our normal activities as viral transmission breaks off. We need to be vigilant for the fall because we will be facing renewed risk in the fall. By then, we're going to have a lot more in place in terms of therapeutics. We're going to have broad testing in place. We need to make sure that gets out into the community. We're going to have better practices in place, and we're going to be prepared. And so I'm optimistic for the future. I want to thank you, Governor, and your team for the leadership that you've shown through this crisis and what you've done for our state and my family personally in terms of making us more safe. And it's been a pleasure to work with you and your team. Thanks a lot.
Hey, Scott, that's great. And please stick around a little bit because we do have some questions from the press. And let me introduce to you Zeke Emanuel, who sadly does not have the same Connecticut roots. He's down in Philadelphia now with the University of Pennsylvania and a little bit of Chicago action there. But and has been an advisor to my wife's firm, which is in Connecticut. So there's a Connecticut link. But more importantly, I think you know Zeke from National Institutes for Health, Public Health, working in the Obama administration, H1N1, dealing with the contagious viruses, has some real experience there on the front line, well-known bioethicist and oncologist. But one of the many things I love about Zeke is he makes it understandable in terms of what we're going through, what we can expect, and what it means to each and every one of us. Zeke, thank you so much for all the help you've been for our committee.
Thank you, Governor, and it's been a real pleasure to every week talk to the task force and try to offer advice and help. First of all, I do want to say you set up a very thoughtful process, I think people were considering lots of complicated issues and lots of complicated opinions in a situation of great uncertainty. And you did bring in some of the most wonderful people who were really able to meld and synthesize a lot of views. Let me say, because of swift action and good public health measures, Connecticut is a really good example of a place where public health measures have worked. The case number are going down when the rest of the country is plateauing, and that is a good sign of how important the actions you took and the government, the state government took, are to putting you in a place where it's safer to reopen. I know that you and the task force have been considering very stringent criteria about reopening in terms of testing, in terms of case rates, and other factors. Connecticut is very advanced on those. I think, as Scott said, and let me endorse, you have really focused a lot of attention on getting the testing capacity up there. I'm affiliated with the Center for American Progress. We put in a very stringent criteria for reopening that deals with testing and deals with the number of new cases coming down and the percentage of positive cases. And Connecticut really has excelled in all of them and has passed our threshold for testing and for the number of cases coming down. I also think, as you and the task force have been thinking about it, a very detailed plan and a three-phase reopening project that does focus in, I think, to re-echo something that Scott Gottlieb said, protecting the vulnerable in nursing homes, prisons, and other circumstances, but also being aware that there are high-risk neighborhoods and working and focusing attention and resources on the high-risk neighborhoods and making sure you have the right infrastructure so that when you reopen, you can address any outbreaks that occur in these areas. I also want to laud the thinking about and the plan to do seroprevalence testing, so you know how many people in Connecticut, what proportion of the population actually has experienced COVID, and focusing in on other high-risk groups as you try to reopen colleges and universities, workers at the front line with frequent contacts. Again, very thoughtful approach to how to deploy the testing in its most optimal manner. And let me just echo two other things Scott has said. This emphasis on using face masks, on staying, having small gatherings, and having as much outdoors as possible are pretty evident in the way that the task force and your government have been thinking about reopening the process. And you've also developed a set of standards for when you might have to hold back and reverse course because their outbreak has gotten so severe. I would also finally say, emphasize two other points. In thinking about how to reopen and how to phase the reopening, I have been impressed by the thinking of both looking at the public health measures on one axis and looking at the economic impact on another axis. Both factors need to be taken into account, and you need to get to that sweet spot, places where the public health risks are low or you can lower them by measures like holding activities outside, and the economic impact is large so that when you open up, you have a lot of people going back to work, and you have a large amount of economic activity that can resume. Using those different scales and melding them together to make informed judgments, I think has been a hallmark of your government and the way the task force has approached it, and even the structure of the task force, having public health people alongside people who represent the economic community. Absolutely important. And then there are some areas where it's clear that the public health risks are very high and the economic benefits are very low, and that you have been hesitant, or the state should be hesitant about rushing into opening those. I personally, very nervous about casinos for exactly that reason. You can't go outside, as Dr. Gottlieb recommended. You have a high concentration of elderly people, and the economic benefits are not large to the state, either in terms of employment or in terms of the number of GDP. But the risks to people's health is very, very high. And I think thinking about how we trade these things off and doing it intelligently is going to be the key to having a success. Let me just end with one word, and I would echo what Scott Gottlieb has said. We are probably going to be lucky for the summer. Maybe the transmission rate and infectivity rate is down. We won't know. We'll find out. But it is the case that weather is warmer. People can do more activities outside, and we should take advantage of that because the documented number of transmission cases outdoors is extremely low. And that does mean that in the fall, come October, the whole situation is going to reverse, and we cannot let our guard down lest the reignite. So I think you have two advisors here who are from different parties, but both giving you very, very similar advice about proceed in the summer and how to make sure that you have the infrastructure in place in the fall should the coronavirus come back and in conjunction with influenza. But you have done this as methodically, thoughtfully, and comprehensively and systematically as any group in the country, and I applaud those efforts.
Thank you so much, Zeke. If I can take the privilege of asking the first question as we tee up from the press. You both have a unique perspective. I always think of testing as a bridge to a vaccine. We have hundreds of companies around the world pursuing a vaccine on a very short fuse. What can we expect later this year, early next year? No idea. Zeke, do you want to kick it off?
Well, I'm at a disadvantage. I'm happy to kick it off, but Scott sits on the board of Pfizer, which has already entered human trials. So let me just say the following. Broadly speaking, there are 4 or 5 different ways of approaching a vaccine. There's RNA DNA vaccines, of which Pfizer is approaching one. There are vaccines of the old style where you grind up the virus and you take parts of it, like the spike protein, and inject that into people. Those are more tried and true methods. Then you try to take a virus that is not infectious in people or doesn't create health problems in people, like an adenovirus from chimpanzees, and you stick some proteins from the coronavirus onto them. That's part of the Oxford effort or the Johnson & Johnson effort. And then there are these sort of artificial vesicles where you stick some of the viral protein on them. The first ones out into humans have been the RNA vaccines because they're easy to produce, don't have a lot of safety concerns. Yesterday, Moderna announced 8 patients. I would not put lots of stock in the results from 8 patients. Only 4 really had a big impact. And I think most of that was not the way we usually release scientific data. It's mostly to raise money for the additional trials. We're going to need large trials of this to see how well it actually raises antibodies and protects people, and also to look very carefully at the side effects because these opening trials are not very large. Remember, we're going to be injecting this vaccine into otherwise healthy people, and any number of side effects are a problem when you're taking healthy people and then potentially make them sick. Some of the advantages, some of the diseases I've mentioned, I do think I'm a little skeptical that we're going to have a vaccine before the end of the year, as the president announced, was urging. I think we need to make sure this vaccine is safe and that it is truly effective. And that's going to require thousands, tens of thousands of people and tests. And there probably isn't going to be a single vaccine. We're probably going to have multiple vaccines that we have to use. And then the big challenge happens. We need to produce it in scale. We need to distribute it, and we need to get it into people's arms. And we shouldn't forget that is going to be a major challenge with major issues around each one of those steps. So I do think the vaccine does solve a lot of problems, but we should not be overly optimistic and give people a false sense of by the end of the year we're going to have something. I think the 12 to 18 month timeline would be warp speed, and that is a much more likely, and even that has big challenges behind it. But it was nice to see the Moderna announcement, but that only begins the conversation. It doesn't end the conversation about vaccines.
Scott, 12 to 18 months for a vaccine? Scott Gottlieb?
I think we lost your audio, Scott.
By the fall, we are going to have, I think, more therapeutics available. There's some antibody-based drugs that are in development by 4 companies in particular, one local, Regeneron, that I think are going to be available, one or more of them potentially, that could be used both as an early treatment and as a prophylaxis. And so the therapeutic toolbox that we have is going to look different. With respect to the vaccine, and I am on the board of Pfizer, which has a big facility in Groton, which is contributing to this effort, but I'm not speaking on their behalf. I think what the Moderna data showed and some other data that we've seen from some early development is that this is a target that we can develop a vaccine against. I think that there's more confidence that we should be able to get a successful vaccine against the coronavirus. And a couple of months ago, we weren't so sure of that. But we've now seen a couple of constructs, vaccine constructs, that have produced an immune response in people and in animals that is suggestive that we should be able to use a vaccine to confer some level of immunity. It might not confer complete immunity. It might be like a flu vaccine, where the vaccine reduces disease severity, but it doesn't prevent you from getting the infection. But it prevents you from getting sick, or prevents many people from getting sick. And it might be very much like a flu shot, where we have to get it on a seasonal basis. As Zeke said, there's a number of different constructs in development. I think a base case assumption should be that we will have by the fall hopefully several manufacturers of vaccines that will have millions of doses, maybe low tens of millions, but we should think of millions of doses available in the fall for large-scale clinical trials. And we might be able to deploy a vaccine in the fall, both experimentally in large-scale clinical trials if we have outbreaks in cities or states, and potentially therapeutically to try to ring-fence those infections, those outbreaks. I think it's unlikely, but not impossible, that we would have vaccine available in sufficient quantities to actually make it available on a more wide-scale basis. And even if we were in a position to do that, if we had the quantities to do that, which is possible, I think the idea that we would have an approved vaccine before the end of the year is less likely, and we'd probably be making it available under what we call an emergency use authorization by the FDA for select populations that are at particularly high risk of a bad outcome, for whom an experimental vaccine, the risk-benefit of that, might make sense. But I think we will have a much different toolbox heading into the fall, and the vaccine is one part of that. But I would just believe that having a vaccine available for widespread inoculation of the population really is a 2021 event, and probably a second half of 2021 event. Having a vaccine available that we can deploy potentially in millions of doses in large-scale trials in the setting of outbreaks in American cities, that could be a 2020 event, and something that we may have available for the fall.
All right, thank you, Scott. Thank you, Zeke. Any questions, Max?
News 8.
For Scott Gottlieb, we've talked about the drugs a lot, but the food supply chain. What do you see happening with the food supply chain? A lot of people can't get beef at the store. A lot of restaurants are opening up tomorrow. They are having a hard time, or high prices of beef. Where are we at? What do you see in the food chain, especially as Memorial Day weekend is coming around?
Yeah, look, this gets back to something that Zeke and I were talking about at the outset, which is the importance of getting resources and testing into sites where you have an at-risk community. And one of those at-risk communities are food handlers. People who work in grocery stores are at risk because they come into contact with a lot of people on a daily basis. People who work in food processing facilities are at risk. They're close together. They can't socially distance at work. We haven't necessarily gotten proper protective equipment into those facilities. And so we've seen a lot of outbreaks in those facilities. And that's what's impacting the food supply chain right now, getting the proper protective equipment into those facilities. And so we need to focus resources on that. This isn't really a state issue. I mean, this is a federal issue that we need to think about how to target those resources into those sites where you have employees that are at higher risk of transmission. I think the actual risk to the food supply, which is a separate question, is quite low. I don't think people should be concerned that there's going to be transmission through the food supply. I think the bigger challenge is making sure that food handlers and people who work in these facilities are properly protected so that these facilities can stay open and these people can stay on important jobs and do so safely and with confidence that they're not going to get infected.
All right, one last question. You mentioned the therapies and the drugs. Are you seeing, you mentioned 3 or 4 different treatments. Is there one in particular that is most positive right now or has worked the best that might be easiest to replicate?
Yeah, well, so I think about what could be available for the fall. There's literally about 100 INDs, active investigational new drug applications on file with the FDA. There were about 73 weeks ago, and it's growing. I think about what can be available for the fall. We now have remdesivir available under an emergency use authorization. Supply of that will grow. That is a first-generation antiviral. It's active. It looks weakly active, but it's active against the virus. And I think if used appropriately, it can provide a therapeutic effect where it can reduce hospitalization and hopefully reduce death. I think the drug is going to be more beneficial if used early in the course of infection and most beneficial if used in people who probably are at higher risk of bad outcomes from coronavirus. But it's a first-generation antiviral, and it's available. And, you know, as Zeke will attest, if you think back to every virus that we've conquered with drugs, the first-generation drugs weren't perfect. They were highly imperfect. But we got successively better drugs along the way, whether it was hepatitis C or HIV or many other viruses. The other drugs that could be available in time for the fall are those therapeutic antibodies that I talked about. There's 4 companies that are fairly far along. They'll be in the clinic this summer. Regeneron, local company, Amgen, Vir Biotechnology, and Lilly all have therapeutic antibodies in development. And what these are basically they're basically biotechnology copies of the antibodies that your body would produce if you were exposed to the virus, and they can be infused therapeutically. We developed these kinds of therapeutic antibodies successfully against Ebola, and it worked. We developed it successfully against MERS, which is a close cousin of this coronavirus, and it worked in large primates. We never put it into humans. We've done it against respiratory syncytial virus, but there's every reason to believe that we should be able to manufacture at scale therapeutic antibodies that can provide both treatment in early disease. They have to be used probably early to really have their full beneficial effect, as well as a prophylaxis. You can use them to prevent people from getting the infection. Now, you'd probably have to redose them on a monthly basis because these antibodies would only circulate for a period of time, but it could be used as a bridge to a vaccine. One or more of these, I'm hopeful, will be available in the fall. I hope one or more of these companies gets across the finish line. The biggest challenge is going to be supply. We're going to be supply constrained, so we're not going to have tens of millions of doses of these, but we may have millions of doses. So we'll have to figure out how we allocate that supply. But if you can couple remdesivir with one or more of these therapeutic antibodies, with vaccines that you can use experimentally, but in the setting of outbreaks, with much broader screening that we're going to have in place, with the kinds of case-based interventions to track and trace that states like Connecticut are investing very heavily in, that's a much different toolbox. I mean, that is a toolbox that can help mitigate the risk of this heading into the fall. It's not going to prevent outbreaks from occurring. I think we're going to have outbreaks in the fall in different cities, in different states, and we're going to have to address that. But the hope is that we can prevent another national epidemic, and we can prevent those outbreaks from becoming very large with this kind of a toolbox.
Thank you, sir.
Wow, thank you very much.
Keep us moving, Max.
Channel 3 Eyewitness News.
Yes, question for our health policy experts. Can you quantify the difference in safety between reopening on May 20th as opposed to June 1st? Like, how much safer will the public actually be on the 1st?
So I don't think there's a major threshold that you're going to go pass that is different over 10 days, right? But what you are going to do is be able to put in place the infrastructure that is necessary and ensuring as much education of the public and as well as the business owners. Remember, a lot of this is about the demand, right? And restaurant can open, but if people aren't willing to go and sit outside and get served, there's not a lot of economic activity going to happen. And you have to reassure the public that they're not going to get sick and contract COVID by engaging in commerce. So this is as much a demand problem as it is a supply and opening problem. And people also have to have the economic wherewithal to go out and shop. And so you have to understand that you have to spend some time convincing the public and convince them to wear face masks, to do the things that they can do, and to make sure that they understand that the businesses have good protocols in place to keep them safe, and the state has good protocols in place to keep them safe. And I think that's part of what you have to have going forward. And the more people engage in activities without a resurgence, or with a resurgence that can be controlled and people see that it's growing safety, you're going to have more confidence in going out and engaging in social and economic activities. So I think that's part of what you're playing on. And you're also, just going to see how other states, other countries are doing and where the problems are. You should remember, almost every place that has opened up has had a resurgence. Whether it's Singapore, you saw a resurgence in South Korea. One guy, just one person is all it took to create 161 cases from one night, infecting 90 people, and then those people infecting other people. So I think the public is going to get used to this slowly over time and be assured that they have that the state has the proper testing capacity, proper contact tracing capacity, and that they are going to be well protected if they do engage in social and economic activities.
Well, sorry. If I could just build on what Zeke said. I think we will reopen successfully. I think the state is being smart and prudent about how we're going about this. And I think that there's a lot of things working in our favor. Now, if you're looking at this purely from a public health question of the epidemic itself, just narrowly thinking about COVID and coronavirus, every day that we wait, we see cases come down and we see capacities increase. And so the risk will be reduced when we reopen for every day that we wait. We have to balance that against the economic impact of staying shut, which is very real, and the public health consequences of being shut. There's healthcare not getting delivered because of the mitigation that we've imposed. And these are the hard decisions that policymakers make. This is the kind of balancing that elected officials and policymakers engage in. I think we're striking a prudent balance here against the risk of COVID and COVID resurgence and getting to a point where we've lowered the risk enough where we can start to reopen to offset the other risks that we're taking from the economic impact. And that has a public health consequence, as well as the very direct public health consequence of the healthcare system really not being fully operational. And the one thing I will say, just to sort of build on what Zeke said, is that we really had no choice to do what we did at the outset of this, because if you look at this just from a purely public health standpoint, you think about all the public health impacts of the mitigation, missed vaccinations, people who didn't follow up with chemotherapy, people who missed routine cancer screening, and the implications for that. And there will be implications for that. That couldn't be delivered anyway in the setting of an epidemic. There was no way we were going to be able to deliver effective healthcare in the setting of an epidemic. So we had to break this epidemic in order to have a functional public health system that can deliver the care that people need in order to mitigate all the risks associated with routine illness. And so I think we're at a point now where we're able to do that. In terms of the risk reduction of 5 days or 7 days or 10 days, every day you buy yourself, you reduce the risk of COVID resurgence a little bit, and you increase the risk on the other side. And we just have to strike that right balance. And that's really what policymakers grapple with.
NBC Connecticut.
Governor, how confident are you on a June 1st reopening for hair salons and barbershops? I know that there are some that want to be part of a phase 2, so even later than June 1st. Others say they've been ready to reopen for tomorrow, and there's concerns that they make preparations now for a June 1st, and then it changes again.
No, we're sticking with June 1st. What happened, Zeke and Scott, is we were planning on May 20th. We had a fair number of salons, so we're not quite ready yet in terms of getting our salons equipped. We had a fair number of stylists who said, give us a little more time when it comes to childcare, give us some time to prepare. And that's what we've done. We said we'll do it on June 1st.
And as the reopening begins tomorrow, is there a threshold, a number that you're looking for where it would reach a point, whether it's hospitalizations, positive cases, deaths, where it would suddenly go and scale back and restrictions would be put back in place?
Well, I think you've heard Josh describe this before. I think the number one metric we're looking at is hospitalizations. No more than 20% of the hospital beds with the COVID patients. We know what type of latitude we have. We have probably 40% capacity in our hospitals now. But along the way, we're doing more and more testing, so we'll be able to detect flare-ups, as Scott said, contain those earlier. So I think we have more tools in our toolbox every month.
And then for Scott, regarding hydroxychloroquine, the president said recently that he's been taking it every day. Medical experts have said they do not recommend that. As the former commissioner of the US FDA, what's your take?
Well, look, I think early on, a lot of people were using hydroxychloroquine off-label, as you know, and people were taking it in the belief that it could provide some prophylactic value. I think a lot of that prescribing has declined as additional data has accrued that hasn't been promising. There were 2 studies published in the British Medical Journal about a week ago. There was a study in Columbia Presbyterian of about 1,700 patients. The Europeans have a big study underway. They did an interim look, so they allowed that trial to go forward, which is an indication that it wasn't causing harm, but we don't know if it was delivering benefit. They didn't allow the patients to cross over, so the signal, evidently, we can infer wasn't that strong. With respect to the president specifically, I would hope that the White House staff has the president in a strong enough protective bubble in terms of who's coming into contact with the president, how people are being tested before they come into contact with the president, that even if there was a drug that could provide some prophylactic value, and I'm not suggesting that hydroxychloroquine does, there's not firm evidence that it does at this time, but even if there was such a therapeutic, the president wouldn't necessarily be a candidate for it because he would be protected on the front end in terms of who's able to come into contact with him. And, based on what we know and what we read in the press, they are implementing pretty aggressive screening in terms of who he's meeting with and who gets into contact and the distancing that he's engaging in. But that would be my hope, that it wouldn't necessarily take a therapeutic to provide protection to the president, that we would be implementing those measures in terms of how people are being screened before meeting with the president.
I have to say, it's a little ironic that the president is taking hydroxychloroquine as a prophylactic and refusing to use a face mask as a prophylactic.
News 12 Connecticut.
Hi, Governor. This question's for you. I want to ask you about enforcement. I mean, as we speak, Cromwell Town Council is holding an emergency meeting to discuss their options to essentially ignore your executive order and allow gyms and hair salons to reopen. Essentially, the idea would be to just not enforce the order, not cite the businesses, let them operate in plain sight. If the towns don't cooperate, how do you get businesses to comply? How do you force them to follow the rules?
Well, I'd say to Cromwell and Enzo, we talked just the other day, let's keep our discipline a little bit longer. I don't want people peeling off, making exceptions. I don't care about these rules. Connecticut's been really good. You ask about enforcement. We didn't have to do a lot of enforcement. You know why? Because the people of Connecticut took our rules seriously, our safe workplace rules, our safe store rules. And I know it's getting summary out there and people are feeling a little frisky, but it's really important to do this. I'm not interested in going out there with state troopers enforcing. I really urge each and every one of you and the mayors to encourage each and every one of your businesses to do the right thing. And by the way, if they're not doing the right thing, customers don't go.
So, Governor, though, I guess getting back to your point, if you're not going to send the state police out there to enforce the rules and the towns just refuse to comply, what's to stop these businesses from opening?
Well, look, obviously I would talk to the mayor. I would say it's a municipal responsibility to enforce these rules. These rules are not just to keep the store owners safe, but the customers safe and your entire community safe. And I would try my moral persuasion, and if that didn't work and the municipal police were not interested in helping out, we'd get state authorities to give a friendly reminder that this is contrary to our laws.
So what state authorities are we talking about here, like DCP, the health department?
Yes, yes.
WTIC 1080 News. Connecticut Mirror.
The history in America since the passage of the American with Disabilities Act is to accommodate as many people as possible on the basis of health restrictions, disabilities, and so forth. I guess this question is for Dr. Emanuel, who has written about bioethics and has never shied away from the more controversial aspects of it. What do you say to people who say, look, this disease hits people of a certain age and people with certain comorbidities, and should there be a push to encourage or further somehow isolate these folks and let the economy reopen to a greater degree?
I'm not sure I understand your link between the ADA and protecting people who are at high risk of contracting the disease and unfortunately dying from the disease. The ADA was passed, for a very good reason, to prevent discrimination against people where they could hold jobs and to prevent people from using various efforts like not having wide enough doorways and other things, of preventing people from engaging in everyday social and economic activities that they were perfectly capable of engaging, and not having the environment systematically prohibit them. What we're doing by saying, look, we want to protect you from contracting a deadly disease is a very different circumstance. We want to make sure that if you're in a nursing home, don't get infected with COVID, and that you get treatment right away, and that we monitor the workers who are caring for you carefully. We monitor you carefully. Similarly, if you're in a neighborhood that's got high density and there's more easy transmission, what we're doing is we're going to try to monitor you and give you good public health advice so that you can protect yourself. So I think they're very different models. The reason to protect people from COVID has nothing to do with their disability, It has to do with the fact that they're at increased risk from a deadly disease. So it's the ADA and protecting people who are elderly or have comorbidities are not related.
Well, the reason I mentioned the ADA, because what I'm really asking about is discrimination. There is a thread of commentary out there. It's not certainly dominant, but there's this thread of commentary out there that suggests let more of society reopen and put the burden on people who are in their 60s and older or have comorbidities to basically say to them, it is your business to stay out of restaurants, to let the rest of society go. So that's why I put it in the context of the ADA. Any thoughts on that?
Yeah, I mean, again, I'm not of the view, and I don't know who will be of the view, that, we can ourselves die so that we can get the economy restarted. That's the cost-benefit analysis we're doing. Those people, they can either lock themselves up at home or they can run risks and die, and we're going to open up our economy to other people. First of all, I would note that about 110 million Americans have some comorbidity or obesity or hypertension or other illness that puts them at high risk. It's not a small group, and it's not only an older group. And second of all, suggestions around public health measures are really to protect people and to protect them from a deadly disease, not to inhibit their engagement in society. And I think that's the major difference. And we would be making that suggestion to them regardless.
And last question, in the course of your discussions in the advisory group, at any point did you weigh the risk that come with the closure of schools? You do hear people talking about the concern of what is the downside of not having children who are perhaps at-risk places who are not in schools where mandatory reporters can see them. There's also the school of thought that says for every point that the unemployment rate goes up, the death rate certainly goes up. I mean, these certainly get kind of into squishy things. But did that play any role or should that have played any role in looking at how we weigh these cost-benefit factors?
Absolutely. So we did discuss the issue of summer camps as a good example. What are the risks of opening summer camps, and what are the benefits of opening summer camps? And taking into account exactly what you said. What are the risks to children in terms of getting an infection? What are the risks to adults if the children do get an infection and go home? Similarly, what are the benefits of kids, from socialization to good nutrition to maybe learning activities, potential other benefits that could be incorporated, and not just to those children. Maybe you can hire lots of teenagers to be camp counselors and tutors to kids who are going into camp. These are very important. You want the governor to take a holistic picture of the economy, the public health, the social factors. And so that was taken in when I had discussions with members of the task force and the governor about this. I am an advocate, for example, of opening up summer camps. I think it's a very good idea. It is not risk-free, and no one should pretend it's risk-free. And unfortunately, we have seen the horrible multi-system inflammatory syndrome. That is a worry, and we have, it's hard to know exactly how many numbers, but probably about less than 200 kids in America. That's a serious worry. And some kids in Connecticut too. But there are also other worries that we have to be aware of, and I think you were hinting at some of them in terms of socialization, in terms of abuse at home and other things. And you really do need to make a holistic evaluation of the risks and benefits.
There aren't hard metrics there, though. So how do you approach?
Yeah, I disagree with you. Okay. I think that there are very hard metrics.
And
there's very good studies about the benefits of socialization. There are good studies about the harms that can come from everyday life. There's, our best estimate about the harms from opening up with kids. But you also have
let me clarify. I meant to balance them against public health, to make that kind of judgment. Obviously, there's a ton of data on the values of socialization, but as far as the work you were doing for the advisory group, you're put in a position of having to weigh one thing against the other, and that's what I was trying to ask.
No, I was trying to give them have a discussion with them about various things that should be considered. My reading of the evidence of what should be considered, suggesting various different things. I offered my opinion. As I mentioned, opening up summer camps, I think is something that should be considered. And I gave them the rationale and what I thought was the balance sheet.
Thank you.
We will move along next to the Hartford Current, and a reminder to to everyone on the call, both keep our follow-ups limited and our answers concise as well. Thank you very much. We'll move along next to the Hartford Current.
Thanks, Max. This is Emily Brindley from the Current. Governor, first to you. I wanted to ask about the advisory group, the Reopen Connecticut advisory group that will be disbanding tomorrow. Can you explain to me the nature of that disbanding and how closely you will still be working with the members of the group? And then can you also explain why the group is disbanding now, right when the reopening is starting, when there's still 3 more phases of reopening left after this one?
I think what they put in place is the metrics that allow us to see phase 1, phase 2, phase 3. I think you'll hear that from Indra and Albert tomorrow. These are folks, amazing volunteers. They put in, I would say, in many cases, over 100 hours a week, back and forth, late at night, emails, text, Zoom. And I prevailed upon them to do this. Many of them going back to their lives, just like tomorrow we're going to start reopening our state as well. I think this is probably a good time to turn that page, although we've gotten to know each other very well, and Zeke and Scott won't be able to hide, and neither will a lot of the friends I've gotten to know on the reopening committee.
So just to clarify, it sounds to me like you're saying that the group is disbanding because they've been working hard and have personal life obligations as well. But what about the obligation to the state to have, and to the people of the state to have a safe reopening plan and a steady committee throughout the entire process?
Look, believe me, they are. They put their heart and soul into this, actively involved. Many of them are going to stay very actively involved. It's just the formal structure of the advisory board is going to, take a backseat as we now move towards implementation of a lot of the key metrics that they recommended.
Okay, and then to the two doctors, I have a question about testing. And can you explain to me why you believe Connecticut has enough testing capacity at this point? For instance, Dr. Emanuel, you referenced the Center for American Progress and their guidelines, but those guidelines suggest a 2% positive rate, and today Connecticut's testing was at 4%, just twice that. So would you each be able to explain to me why you believe the state has enough testing to begin reopening?
Well, I think the threshold, and correct me if I'm wrong, the threshold was like 42,000 tests for the population. That would be equivalent to other countries that have done an excellent job of testing, and Connecticut's at 50,000 with a growing capacity. And remember that the percentage of positivity depends upon the community, and there's been a steady drop, as I think the governor mentioned, in the positivity as you're testing more people and you get a better handle on the seroprevalence in the community. I think actually the cap figure was 3%, if I'm not mistaken, and Connecticut is just above that, and by June 1st will probably be below that. So I think you're not a state that is at 10% positivity, and so it's a very different circumstance. And you have growing testing capacity and positive capacity. That's exactly the place you want to be.
Yeah, I mean, I would just build on what Zeke said. I think it's exactly right. If you look at the various proposals in terms of what the testing capacity should be, including the one that we put out from the American Enterprise Institute, and what kind of positivity rate you're targeting in the setting of a reopening, Connecticut's right about there, and it's going to ramp quickly, and they're going to continue to build it. And there's no sort of magic formula to this. There's no prescription. That's the right amount. Where the state has the capacity right now to do the testing, that most of the groups have taken a hard look at this, prescribed, and it's going to build quickly. I think you're going to see testing capacity as we head into the summer ramp very quickly as you have more antigen-based tests get into the market, like the Sophia 2, where you saw the authorization over the weekend of that antigen-based test. We're going to see others come into the market. OraSure has one. There's other companies that are developing these. We're going to see more point-of-care platforms like the Abbott ID Now come into the market. Becton Dickinson has a platform that they're going to probably get authorization for. And I don't know anything. I just know these companies are working on it and are going to get these authorizations soon. We're going to see next-generation sequencing come into the market to be used to do large pooled samples. I'm involved with that in my personal activities. And we're seeing the PCR backbone, which is what we've been largely relying on, continue to build. And so you're going to see a lot of new technology enter the market over the next probably month. That's going to create sort of technological inflection points where we'll literally be bringing millions of tests per week capacity into the market. So this is going to build very quickly from where we are right now.
Move along next to Connecticut Public Media.
You're one day, or tonight's the night before the state begins to slowly reopen. Any second thoughts, Governor? How are you feeling on the eve of the first part of the reopening?
I think we made the right decision. I think, as you heard both Scott and Zeke say, there is a balance, and there's nothing that is risk-free. But I think Given the metrics we put in place with the best scientific team I think any state's been able to put together, we've hit those metrics. We're exceeding those metrics. I think we can proceed on a very thoughtful basis with those businesses that are least likely to be dangerous and most likely to have a real economic value for the state. And I'm looking forward. I think this is a good day for the state, and I hope everybody maintains their discipline, because that's going to make it successful.
Move along next to CT News Junkie.
Thanks, Max. Hi, Governor. I wanted to know, CMS put out guidance last night saying that nursing home staff should get tested on a weekly basis. And I'm wondering what Connecticut is doing or what guidance you're offering.
Well, I'll hand this over to Josh. The good news is we're getting everybody tested at every nursing home, and that's a pretty good start. Josh?
Yeah, so as we've articulated in these press conferences before, that's very consistent with our goals in our state testing strategy that we've been trying to execute against for several weeks now. So we're thrilled to see the federal guidance come out that's in line with that. I think that'll help create more momentum for us, and Commissioner Gifford is working on actions to ensure that nursing home worker testing is ramping up quickly.
Do we have the capacity right now to do that? I mean, you know, if we're testing every nursing home resident, I'm thinking that's around 22,000. There's probably about 30,000 nursing home workers in these homes. That's 50,000. If the state isn't up to the capacity of 70,000 by next week, we could run into trouble.
Yeah, when we look at the ramp up that's occurring with our laboratory capacity that we've put under contract now in the state, that won't be the limiting factor. What will be the limiting factor is the operations of getting into the nursing homes, having the repetitive system set up to do the screenings every week or every other week at least to start. So there's a lot of work underway to get that done, but we'll have the capacity when we need it.
And do we know if today's computer outage is going to impact the unemployment claim processing at the Department of Labor?
Too early to know. The team's making good progress getting the systems restored right now. We're hopeful that it won't.
Thank you.
Move along next to the Day of New London.
Hi, question for Dr. Gottlieb. You co-signed a letter to Congress recently calling for an increase of the workforce for contact tracing. Do you think Connecticut's work and volunteer force for contact tracing is large enough at this point to start reopening tomorrow? And how do you think contact tracing is going to become more difficult when we start to return to normal activities?
Yeah, you know, I'm not the right person to ask in terms of what the capacities are in the state right now with respect to the contact tracing. I don't know all the details of that, and so I'd put that to the administration. I think the state has made a very firm commitment to using case-based interventions and contact tracing as a way to mitigate risk going forward. Not every state has, and so this state has made a commitment to that. I think this is going to become even more important as we head into the fall. So there's a lot of time between now and September to try to build out these capacities. I know the state's committed to that. I know the report that the expert group's going to deliver is going to lean heavily on that. I've had some conversations with them in terms of their recommendations. And so this is going to be, it's important now. I don't want to diminish the importance of these interventions now, but they're going to be exceedingly important in the fall when we have cases going up and not down, and we need to lean heavily on these case-based interventions to prevent another large epidemic.
Thank you. So Governor Lamont, to follow up on that, do you have the numbers of how many volunteers and workers we have currently doing contact tracing?
My understanding is we're working with our own Department of Health. We're working with local departments of health around the state. We have hundreds of people spread across there. We also have volunteers in the greater New Haven area. We have a course at UConn. I think we'll be ramping up from probably 300 or 400 people to 700 people very soon.
Yeah, and Dr. Gottlieb really made the key point, which is it's less about how much capacity we have today. It's really about, and Dr. Carter and our other experts we've had, Dr. Coe, have made this exact same point, which is it's really about getting the infrastructure in place so that when the cases get to be very low, you have all the coverage you need to ensure that as you start to see infections increase potentially in the late summer or the fall, that you've got all the infrastructure in place then to be able to really contain it.
Great, thank you.
Move along next to the Associated Press.
Good afternoon, everyone. This is Sue Haig. Josh, I just wanted to follow up on Christine's question regarding the testing of nursing home residents and staff. Is the plan to have weekly or every other week testing eventually, and when?
Yeah, so I think
that would be of every resident and every worker. I'm sorry to interrupt.
No problem. Yeah, our goal in our testing strategy is to ultimately scale up to test every worker every week. Some of our neighboring states, New York has mandated that twice a week, in fact. But to start with, it'll probably be every other week as we ramp up our capacity. And residents will be, to some degree, dictated by the degree to which we see positive cases in the workers, because they're ultimately the ones coming and going from the facility. But our goal would be to do point prevalence studies in each nursing home about once a month as well.
Thank you. And Dr. Emanuel, you said that you would be personally nervous about casinos opening. And I know Mohegan Sun Casino, they're talking about taking all these steps like installing UV light air handling systems and air duct disinfecting systems and thermal temperature checks. Does that make you less nervous?
They're good, and I, to be honest, don't know exactly what they're planning to do. But I am nervous about the age cohort that visits, the comorbidities of the people who visit, the fact that it is indoors, even if you do have disinfectant, having someone sit next to you who sneezes or coughs. The air handling system can be all it is, but it's not the same. And I would also ask you, look at the economic impact overall and the employment impact overall to the state. If you want to really focus on employment, economic impact, and reduced public health impact, that's the sweet spot you want to find. And you want to find those businesses that match that, or where you can create an environment that matches that. You're not moving gambling outside.
Move along next to
Hearst. Do those things work?
Sorry, Sue.
Okay, go ahead. I was just asking if those things worked, like the UV light air handling system.
Well, the air handling system is to increase ventilation and increase the circulation. And, again, I don't know the details of what they're planning to put in. And we also know that thermal checking is, you can pick up some people that way, but it is far from specific and far from sensitive. There are a lot of people who have COVID who don't have a fever.
Thank you.
Hearst, Connecticut Media.
Hi, this is Ken Dixon. Thanks for joining us today. Scott, could you, is there demographic information available on people who've gotten COVID-19 who had the flu shot, or is that just a belt and suspenders prophylactic?
Yeah, I mean, the only data we have is we have some case reports from early on in both China and the Philippines looking at people who were co-infected with flu and COVID and did very badly. And so, there is a risk of co-infection if you're presenting to the healthcare system with flu and you get COVID while you're in the hospital, or a healthcare system where you're presenting with COVID and you catch the flu. We know that there's been cases documented where people have had a more significant decline because of co-infection. And so that's certainly something to be concerned about. But, the other thing to be concerned about is just overall healthcare resource utilization. And then the challenge of differentiating between COVID and flu, we're going to have to be testing for both. And the more people we have presented to the healthcare system with flu and getting tested for flu, the more it's going to put a strain on the healthcare system to be testing for COVID. And so the more we can do to reduce incidence of flu this fall, the more positioned we're going to be to adequately address the risk of coronavirus spread. And we should all be hopeful that this is going to be a mild flu season. I think that all the things we're doing to reduce coronavirus spread, hopefully is going to pay dividends in terms of reduced flu spread, and we'll capture some of the productivity gains from reduced flu transmission as a result of all our vigilance related to coronavirus.
Thanks. And Governor, when your latest executive order came out last night, on the face of it, it looked like movie theaters and large gatherings and gyms would open on the 20th. But is it safer to assume that there would be reduced capacity, or indeed the 6/20 date is just kind of a benchmark to look at?
I call it a benchmark, Ken. What we're going to do is see May 20th, take a look out 2 or 3 weeks, see how we're doing against our different metrics, see if people are following the protocols, and make some determinations about some of the phase 2 openings, give people a little bit of notice. That's our plan. I think it's too early to say what's going to happen on the 20th.
Thanks. And one quick one, Josh. If we've got 3 health districts working on the contact tracing right now, when do you, can you give me a better idea of like the rollout, like when you would have half the state covered, or is it still too early to in the volunteer process?
Yeah, it's a little early, but like most IT implementations, usually the first few are a little slower. You kind of work out the kinks, and then the adoption starts to take off. We'd expect to see something similar here and be well prepared with the system deployed across the state, well before we get into the time that we really need it.
Okay, so where do you see things in the next couple of weeks with that? Still training people?
We'll be onboarding people for a long time, right? We're going to be bringing on additional health districts. We're going to be bringing on additional surge capacity. So that'll continue in the coming weeks. But every day and every week, we'll have more people on the platform.
Thank you.
The Waterbury Republican American.
Thank you. Just to follow up on Ken's question, Governor, there's a coalition of owners of gyms, fitness centers, dance studios, and karate studios that are circulating a petition asking that they be allowed to reopen with precautions on June 1st. Why aren't these businesses being allowed to open at this time or at that time, or maybe on June 20th?
I'm listening to people a lot smarter than I am on these very subjects, Paul, and they just thought those are areas where it's much more difficult to contain the virus, much more likely for it to be spread, and probably a place that we should wait right now and not a key priority, certainly not on June 1st.
And what about massage therapy businesses, tattoo parlors, nail salons? When might they expect to be included in one of these reopening rounds?
Again, I would think they'd be, we'd give a clear indication in and around the June 20. And obviously you do these on a one-on-one. If you're a massage or something, that's different than being in a larger facility. So it depends on the nature of the setup as well.
Okay. And real quickly, final question. Yesterday when I asked your acting public health commissioner about the possibility of cases going up after the reopening, she said she seemed to think that might not happen. We've had 2 experts that you invited on today that told us to expect that to happen. What does your reopening plan anticipate? Do you anticipate an increase in the number of infections as a result of reopenings?
I think you'll see certainly more documented cases as the testing goes up. Scott and Zeke gave me some comfort that maybe July, August, we may dissipate a little bit the nature of the infection rate. We've got a lot of capacity built in our system, starting with hospitalization. But listening to Zeke and Scott, I think a little bit about October now is a potential where we got to be very careful. Fortunately, we'll have the PPE and the capacity to be able to handle anything that could come about then.
Okay, thank you very much.
Boceto Media. Fox 61.
Hi, Governor. New executive order last night now gives the local health director the power to shut down facilities like restaurants, the hair and nail salons, if they're not complying with reopening regulations. But will local health directors be in any way legally required to do these checkups on businesses, or is it on a wait for a complaint basis as residents really want to feel reassured?
Yeah, if I was the mayor of a town and I had my local health department and there was some evidence that a store or a restaurant were not really taking our protocols very seriously, you bet I'd get the health department out there and I'd say, this is in the interest of the broader community, not just the people in this building. So I want you to take this seriously. Otherwise, we'll bring in other authorities.
This morning, you said the communication system in the Department of Labor is ramped up. We still have many people emailing us saying they're waiting hours on the phone just for it to hang up on them. Are you going to add more people than the Department of Labor has already pledged to add to help answer calls at the department?
We'll do whatever it takes to make sure we take care of the people, those that are calling in. I think the bulk of them we have taken care of. Right now, we have some irregularities, and we got to do a better job, because you've asked me about that before. I think I just got this signal, Scott and Zeke, that was our last question. I really appreciate being here. I've never been so fascinated by a conversation about multi-system inflammatory syndrome and hydroxychloroquine, and a lot of things I'm learning over the course of the last couple of months. And what you got to know, and why I really wanted them to be here, is to give you some confidence that we're asking the very best and the brightest, those from the state and those beyond, that advise us going forward in terms of what we got to do so we can get that balance right. And we were so fortunate that Zeke and Scott were able to spend as much time with as they were here. And somebody asked me earlier, are you confident about May 20th? I'm always cautiously confident, but I will tell you that today our flags have been at half-mast for a long time, and now they're at full mast. And that does not mean some guy's hanging up the mission accomplished banner. What it does mean is, if you guys stay disciplined, focus on what we got to do, make sure you wear the mask, listen to what Scott and Zeke said. I think we're going to turn the corner on May 20th, and we'll be able to get through this summer together as a state. And I really appreciate each and every one of you, what you guys did today. Stay in touch. Scott, Zeke, take care, guys. Thanks.